Do you remember a few weeks back when we talked about plague masks and how they were used to protect people from miasma? Well, today, let's talk about how the miasma theory was proved wrong. Miasma is a highly unpleasant or unhealthy smell or vapor due to poor sanitation. The theory was that miasma was the cause of the spread of disease. Experts believed that all diseases were spread through miasma, which is pretty understandable when we consider that this theory was popular immediately following the industrial age. Major metropolitan areas were likely filled with smog, many unpleasant smells, and widespread disease at the time. In August of 1854, London was experiencing an outbreak of cholera. Cholera was called the Blue Death due to the gray-blue color of a person's skin when they were severely dehydrated. People who are infected with cholera experience excessive diarrhea, vomiting, dehydration, leg cramps, and restlessness or irritability. Can you imagine the smells coming from the people suffering from cholera? Fighting the miasma theory was definitely an uphill battle. Now enter John Snow. No, not him. Him. Dr. John Snow originally trained during the first cholera outbreak in 1831. Dr. Snow founded the London Epidemiological Society during the second cholera outbreak in 1848 to advise the government on ways to combat cholera. In 1849, Dr. Snow set out to prove that cholera was spread through bacteria and could be preventable if the government took proper steps. By this time, over 10,000 people in London had died from cholera, and the government was ready to listen to Dr. Snow. London's 1854 outbreak of cholera was the third in 25 years. To prove his theory that cholera outbreaks were caused by contaminated water, Dr. Snow began to collect information about the people who had died from a cholera infection. Many of the 600 cases that Dr. Snow investigated were using the Broad Street pump for drinking water. He also noticed that brewery workers and those living in poorhouses used local wells and were not affected by a cholera outbreak. Dr. Snow created maps showing that cesspools and sewage in the Thames River were causing the spread of disease. All of the data pointed to sewage and contaminated water coming out of the Broad Street pump as the cause of cholera in the area. The handle of the pump was removed, the people using the Broad Street pump found water from cleaner sources, and the epidemic quickly ended. Today we know cholera bacterium can be found in water or foods that have been contaminated by poop. Dr. Snow was able to identify that the Broad Street pump was contaminated before it was widely accepted that bacteria caused the spread of certain diseases. Taking the handle off the pump effectively stopped continued exposure to bad water in the neighborhood until a better water system could be put in place. The current public health system uses many of the methods that Dr. Snow pioneered, although depriving an entire neighborhood of their water source wouldn't happen today. At Two Rivers Public Health Department, we use maps, interviews with individuals experiencing symptoms, and public health interventions to stop the spread of disease. Many people are aware of these practices because of a certain respiratory illness that we won't mention here. But did you know that these tools are used every day at the health department? TRPHD's public health nurses conduct many interviews each day about many diseases. Nurses call all individuals who have a positive laboratory test for E. coli, salmonella, tuberculosis, and more. Nebraska has a law stating which diseases are reportable to public health so that we can intervene to stop the spread of disease. Interviews for foodborne illnesses tend to take just a few minutes and help public health identify possible food items that might be contaminated, while investigations into the spread of tuberculosis can take much longer. Many disease investigations require a team approach where the health department works with local leaders, law enforcement, public works, and others. In that way, together, we can prevent the spread of disease.